thanks to Dr. Brent Roussin for joining me here this morning as well. Brent, thanks again to you and your team for all your efforts on behalf of Manitobans. Today's a cold day in Manitoba, but it's a big day for Manitobans, especially for our, I would say today, for our local small business owners who are very, very eager to offer their services and products to you. Many Manitobans have missed that opportunity to some degree over the last few months. Today we're announcing that we are moving forward with some additional changes to our restrictions. These changes, once again, are cautious changes to ensure we continue to protect and safeguard Manitobans' lives. Aujourd'hui, nous annonçons que nous procédons des changements supplémentaires à nos restrictions. Ces changements sont encore une fois des changements prudents pour nous assurer de continuer à protéger des vies du Manitoba. You'll remember I observed 3 weeks ago that if Manitobans remained cautious, as we have been, and if we continued to follow the fundamentals together that have enabled us to successfully bend our COVID curve downward and keep it down, we would be able to share some more good news in the coming weeks, we hoped, and get back to doing some of the things that we love and seeing some of the people that we have missed. Thanks to the caution of Manitobans, we've earned more such good news, and today we have the opportunity to acknowledge as well that the caution that we have demonstrated, if continued, will give us the opportunity to have perhaps even more good news and good days in the future. Over to you, Brent.
Well, thanks, Premier. Good afternoon. Today we're announcing changes to the public health orders. These are be effective for all of Manitoba, 12:01 a.m. February 12th, so that's Friday morning. The following are subject to further public health measures like physical distancing, as well as contact tracing, as listed in orders and a news release. Restaurants and licensed premises to reopen at 25% capacity, with patron groups limited to members of the same household only. Outdoor rinks to reopen for casual sports and organized practices, and as well as individual instruction, but no multi-team tournaments will be allowed. Gyms, fitness centers, yoga studios to reopen at 25% capacity for individual training or one-on-one training. Indoor sporting facilities, such as rinks, gymnastics clubs, martial arts studios, could reopen at 25% capacity, but this would be for individual instruction only. Places of worship to hold regular services at 10% capacity or 50 people maximum, whichever is lower. Self-help groups, such as those related to addiction, could hold meetings at 25% capacity of the location's capacity. Museums, art galleries, and libraries to reopen at 25% capacity. Personal services, businesses to reopen at 25% capacity. This includes things such as pedicures, electrolysis, cosmetic application, tanning, tattooing, other massage services. Photographers and videographers to offer services to individual clients and those in the same household, as well as weddings. Film industry can begin to work on new projects. The orders will formalize the changes for all of Manitoba, replacing the general COVID-19 prevention orders made on January 28th and the Northern Manitoba prevention orders made on February 1. This will keep the entire province at the level red or critical. These new orders bring the entire province under the same restrictions. These are in addition to the restrictions in place over the last 3 weeks for the rest of the province. They include household visitor restrictions of up to 2 designated people, visits of 5 people plus members of a household on an outdoor private property. Retail stores continue to be open at 25% capacity or a cap of 250 with adequate physical distancing. Non-regulated health services, hair salons, barbershops open at 25% capacity with physical distancing. So you can see these new orders are going to allow us to resume many of the activities and services that we enjoy. We certainly can't let our guard down. There's lots of reasons to remain very cautious, but the hard work of Manitobans have brought us back to a level of community transmission where we can once again get back to these things that we enjoy. The fundamentals are going to be with us for the near future, for the foreseeable future. And the best way to continue to allow us to reopen things cautiously as we move forward is to stick to those fundamentals. One of the most important ones is to stay home when you're ill, even mildly ill. Stay home, self-isolate, get tested, have the household stay home pending those results. This way we can continue with our progress to keep things opening in Manitoba. We continue to have a large part to play in keeping our case numbers down. We've never been helpless against this virus. We saw our numbers tracking in November and December in very dangerous levels, putting a lot of strain on our healthcare system. We weren't helpless then, we weren't helpless now. Our restrictions have brought us back in, and the actions of Manitoba have brought us back into these manageable case numbers. I know just with all aspects of our orders and in previous iterations, there's always questions about why this particular section is allowed while something else isn't. And the answer to that is we just can't open everything at once. If we get back to where we were in October, we'll see November numbers. There's nothing that's changed since then. So we have to have a cautious approach. So there'll always be that the desire to get back to things we miss and love, the desire to get our business back to where it was before. But we have to be cautious, or we will have that effect where we have to shut things down again. So we want to take that real cautious approach so we don't have to go backwards. In these orders, we've also reviewed priorities for Manitobans. Many Manitobans have added their voices to engagemb.ca. And we take that in consideration as well. And so with that hard work and dedication to this date, as well as fundamentals going forward, we hope to be able to continue our progress moving forward. So today, we're also announcing that we have a confirmed case of the B117 COVID-19 variant in Manitoba. This is also known as the UK variant. This case is related to international travel. This individual has since recovered. The initial test results were received on January 22nd, and the test was sent to the National Microbiology Lab for further sequencing, and the results were received late last evening. There were 5 household contacts that were all self-isolating, none of which have become a case. And of course, this is not unexpected. We see this variant in our country and internationally, and we've set up our protocols for just this type of scenario to identify it, to ensure that people that are high risk of it are appropriately isolated, to decrease the likelihood of that transmission in the community. And so this case was linked to travel, and we don't have any evidence to suggest further transmission within Manitoba. And this further illustrates why we have our travel restrictions in place, to protect the introduction into the community of these type of variants. Because things are controlled, because of the restrictions we have in place and protocols, we're still okay to continue with our reopening plans. But it's also a reminder that we're not out of the woods, that we need to be cautious moving forward. We've detected this variant now, and so at the same time, we're loosening some restrictions, but all Manitobans have to be on guard. We can't let our guard down. So do follow those fundamentals. Do not travel except for critical purposes. Get tested if you have symptoms, even if they're mild. And so thank you again, Manitobans. I'm going to pass it back to the Premier.
Thanks very much, Dr. Roussin. And thank you also to Manitobans who have been doing the right things, who have been following these fundamentals that we've been preaching for some months now, and know why, because it saves lives. It saves lives. And as we do this, we remind each other that we're all in this together. And so I say a special thank you to Manitobans for giving us the opportunity today to reduce some of these necessary restrictions in a cautious way. At every step of the way throughout this pandemic, we've involved Manitobans. We've endeavored to reach out directly to Manitobans and give you the opportunity, if you'd like to give us your input, your feedback, your opinions on a variety of the measures that we've discussed over these last number of months. And increasingly, Manitobans are doing that. So I want to say thank you to you who chose to get on Engage MB and give us your thoughts. We had over 33,000 responses since just February the 4th on these measures that we're pronouncing on today. We measured your comfort level with issues like visiting a restaurant, going to a gym or a yoga studio, or taking part in outdoor sports and activities and much more. And I understand those results will be released, so the media will have a chance to review the feedback that we received as well. Understandably, some of you said, whoa, and some of you said, hurry up. And we know that you know, when you talk to a group, you're not going to get the same opinion from everybody. And we wanted to say today, I think, to all Manitobans, we are proceeding with caution. For those of you who say, you know, go faster, remember that we can't have a yo-yo here. And, you know, it's some of the people that are saying that to me and to my colleagues, elected colleagues, most vocally are small business people. They don't want us to have to open up and then go back. They don't want to see a lapse in the progress that we're making together. So that's very clear. To those of you who say go slower, I'll say again that we can't let fear be our master here. We have folks who have waited patiently and done their very, very best to support this provincial effort, who know that they can offer services safely in their little businesses, or they can offer services to us in their stores, and they're ready to try. And I think this is an opportunity for us to go slowly and cautiously in the direction of helping those folks who are our friends and neighbors out there to get an opportunity back to be in business and to give the services that we need. And also an opportunity for us to, from a mental health and a physical well-being standpoint, to do more things. I said 3 weeks ago that we were going to be cautious because winter wasn't here yet. I think it's here. And I said also that COVID variants aren't here yet, and they are now. And for the first time, we've had a case here in Manitoba. And the vaccines aren't here yet, not even close. So it's a marathon. It's not a sprint. And we need to continue to be cautious. That level of caution has to stay high. And we have to remember to do the right things, to play defense. The fact is that the inability to get vaccines out to the provinces, and not pointing fingers, just saying that means that people are going to get COVID. And as a consequence, that people are going to lose their lives. And that reality is here. But we, as Dr. Roussin has quite rightly said, we are not powerless in this. And if we follow these fundamentals and we do this well, as we have been doing, we can minimize the hardship and the grief that we're going to cause to our friends and neighbors here. The lack of a vaccine means that more people are at risk. It means that more grandparents and parents and brothers and sisters and children and friends are at risk from COVID. We don't have the vaccines we need, so we have to keep doing our part to protect each other. We need to be cautious. The Prime Minister's assured us that he will be making vaccines available in the next few weeks, that we're going to be catching up as a consequence of the delays and deferrals of orders that have happened. And we certainly hope that is the case. Même avec moins de restrictions, nous devons être prudents. En fait, encore plus prudents. En l'absence de vaccins, le gouvernement fédéral suivra les principes fondamentaux et la façon dont nous sauvons des vies. We must and we will continue to proceed with caution to ensure that we continue to protect one another. Remember, this is not the time for non-essential travel. Remember that when you get together inside, you give COVID an opportunity to make a comeback. Don't have a COVID party. You're doing no one a favor with that. Stick to the fundamentals, limit your risks, avoid the 3 C's, close contact settings, crowded places, and closed spaces. Wash your hands. Stay home when you are, or any member of your family is ill. Wear a mask, limit your close contact, stay positive, stay supportive, stay hopeful. We're going to get there. Happy to take your questions.
Thank you, Mr. Premier. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this morning from CHVN, Taylor.
Hi, good morning. We've got lower case numbers, reopenings happening. What is it going to take for the province to move out of level red?
So, with any of these indicators and our progress, there isn't certainly one thing. So we look at a number of our indicators, and the total case numbers, we look at the test positivity rate, we look at our, the strain on the healthcare system, and then now we've added another variable on these variants. So we'll be watching those quite closely. So it's not one thing we can point to. We are certainly in the right direction. And if we continue in this direction, then yes, we're going to be at a place at some point in the future where we can move out of red.
Thanks. And I know I've asked you about this before when it comes to places of worship. Do you have any advice for people who are returning or some reassurance for folks who can't yet?
Well, I think for the, place of worship, we've been able to, allow some of the capacity there. We know that this, prolonged indoor contact is where this virus flourishes. And so again, none of the orders that we do have ever been a reflection on people's hard work or their a reflection on how important they think this is. It's a reflection on the virus. And so prolonged indoor contact is challenging. And so no matter how careful you are, if we have a crowded place, prolonged contact, we're going to see transmission. So that's why we have such strict limits on capacity at this point. And, and I think that there's, from what I've seen, we've had some great partnerships, great stakeholders in the faith-based community to run.
From the Winnipeg Free Press, Larry.
Premier, have you heard of many resignations from boards, agencies, and commissions since your travel directive last week?
Nope.
So it's been pretty quiet on that front. My next question is for Dr. Roussin. Is it inevitable that all these publicized variants will arrive in Manitoba, and what specific preparations is the government making to deal with the arrival of these variants?
I'll just cut in. Sorry, Larry, I didn't mean to cut you off there, but 2 resignations, both reported, I think, last week. None others as of today.
Okay, and Larry, yeah, and so we do anticipate the variants of concern being here. Certainly we've seen the UK variant. Like I mentioned, these RNA viruses have many variants, so we've detected many variants in Manitoba over time, just none of them really had any clinical significance up until now. And so we do anticipate seeing the other variants of concern here in Manitoba. The things that we've already have in place are to put us in a position like we see with this one, where somebody's related to, the case is related to travel, that they and all their contacts are appropriately isolated to reduce the chances that we have transmission within the community. We've upped our screening for variants, and we'll continue to up that moving forward. And so we just need to do whatever we can to delay this introduction of these variants into the community.
From Global News, Joe.
Hi, Dr. Roussin. I am just wondering on the loosening of restrictions for restaurants. Do you have any recommended best practices for restaurants having to make sure that people are coming in are from the same household?
I think that this is, an important, requirement that we have that's allowed us to open up at this point. Without it, without that requirement, we probably couldn't, at a public health view, feel comfortable with opening up restaurants. So it's really important that Manitobans and businesses adhere to these restrictions. And so I think that, like all of our public health restrictions and orders, there's a degree of reasonableness on here. So I think there should be reasonable attempts to ensure people are from the same household. And I would really encourage, it's in all of our best interests. Remember, if we have groups of people with prolonged indoor contact at restaurants, we're going to see numbers rise. We're going to see cases linked to restaurants. And if we see that number climbing, we'll have to be back at further restrictions. So it's in everyone's best interest to ensure Manitobans are following these orders.
And can you just maybe explain why we can go to a restaurant with someone from your household, or you can't go to a restaurant with somebody from your outside your household, but you can have them at your house instead?
Right. So we have very strict limits inside the house, right? A maximum of 2. And so there's a number of issues with this. As again, to be able to open up the restaurants where we have prolonged indoor contact, where we are right now with the progress we're making, we wanted that to be limited to people who are our usual contacts. So that is most commonly household contacts. You're right that could include a +2. That leaves us in a position to have no way of enforcing that. Right? There would be no way to be able to say that the 2 people that were at a restaurant happen to be the 2 people that you normally have over at your house. So to move forward cautiously, to be able to safely recommend opening, we had to have it in a manner that is somewhat reasonable to enforce.
From the Brandon Sun, Michelle.
Good afternoon. Could you please list for me the businesses or the sectors that were denied on this round of orders and when they might be under consideration again?
Yeah, I don't think I can, list a myriad of different sectors that are out there. So we provided the list that's that we're opening, and as we move forward, we'll continue to take a risk-based, evidence-based approach to opening further.
Okay, thank you. And for the Premier, will there be another round of Manitoba bridge grants for those businesses not allowed to reopen yet?
We're in the advanced stages of discussing with representatives of the business community additional supports to add to the already most generous supports that Manitoba is offering the small business community. We'll be looking to focus on those sectors where companies are the most impacted by the closures and by the impacts of COVID.
From CJOB, Will.
Yeah, good afternoon. Good morning to you both. Dr. Roussin, to what extent do you think the loosening of these restrictions may be reflected in our daily case counts and other trends in 3, 4, 5 weeks' time?
Yeah, I mean, it's really difficult to speculate. We know that the transmission of this virus is increased the more interactions we have, the more contacts we have. So if these restrictions here are followed appropriately, then really the goal is to not see a significant climb in case numbers. We know that if we start seeing larger household gatherings, if we start seeing gatherings at restaurant tables for people outside of the household, then then we're going to start seeing increased transmission again, and then we're going to have to be at another point of decision on whether we have to move backwards. So these orders are written to be protective against a significant increase in cases, but we rely on Manitobans to follow them.
Okay, thank you. Dr. Roussin, shifting gears a little bit, there's a group in court today who have taken the position that your ability to issue public health directives is unconstitutional because lawmaking has to go through the democratic process, go through our elected representatives. Could I get your response to that? And maybe, Mr. Premier, if you want to jump in on this one too, I'd appreciate that.
Yeah, so I mean, that's in front of the courts right now, so I'm not going to comment on that.
So I'm not, I think COVID should be declared unconstitutional. I think we should all agree on that. The reality is we are doing our best to protect the lives and well-being of the people of our province, and that's what Brent and I are going to continue to do, and that's what I know most Manitobans want us to do.
From the Winnipeg Sun, Scott.
Hello, good morning to both of you. Dr. Roussin, can you clarify when you guys caught wind of this variant case, when you would have kind of suspected it, and why did it take so long to at least suggest that it could possibly be in the province?
Yeah, and so that's the genetic sequencing is what's the rate limiting step. So there's a turnaround time at the national lab for that. So I heard about this about at 9 last evening.
Okay, thank you for that. I'm looking at the orders today. Some things have changed. At least the language in the release has changed a little bit in terms of gyms. Are gyms allowed to open wide, based on the 25%, or is the one-on-one individual training still in place for that, or has that been cut out since the last orders? Can you kind of provide a little bit of clarity on that?
Yeah, thanks for that. So what we did here was just because of how other orders were written in the past, we focused at first on the gyms and fitness facilities. So we said, one-on-one training or individual training. We didn't want group classes, so limited capacity. And then in our, further deliberations, we saw, this individual training, this reduced capacity. Is it really significant on the specific location as long as these things are followed? And so that's why you'll see it much more broad now, where if you had individual one-on-one training at, say, a hockey rink, that would be fine, or at a martial arts studio, that would be fine. So the gyms and fitness centers, we had the individual training option there. In the other ones where we've broadened it, we're still going to require the sort of the one-on-one instruction. That's the best way to ensure that all the protocols are being followed. But we did broaden that more than what we first discussed, just because it's all sort of risk neutral, and we wanted to give people much more opportunity to be active.
From CBC Manitoba, Bart.
Hi there, Dr. Roussin. On a similar note, the language regarding restaurants and lounges changes. There's no reference to 10 p.m. closures. Is that eliminated, and if so, why?
It's not eliminated. That's in the orders, so that's still a requirement. Thanks, Bart.
Okay, and back to the variant. Because there is a lag between the case being caught and the genomic sequencing being completed, and as you mentioned, you heard about it last night, is it it's safe to presume this is several weeks ago that this case occurred, and then disabuse me of that notion if I'm incorrect. Based on that, do you assume that there are other cases in Manitoba of the variant? Based on, if you find one, there's probably more.
I think that there's certainly a possibility, right? This is the first variant that we detected. I think as, in other provinces, we see some more significant transmission. We don't have really evidence of widespread community transmission, so it's certainly possible, but we've been, sequencing the highest risk samples and this is the first we've detected. We've also now begun screening a much more a broad array of our samples. So it's not genotyping or sequencing every sample, but we are going to be reaching a point where we're screening every sample to give us an early indication of cases that might be more likely to be a variance.
From the Canadian Press, Steve.
Oh, hi, Dr. Roussin. Can you tell us how long ago the individual who has the variant, how long ago they returned from travel, and are you confident that they've been in contact with certainly not other people the entire time?
Did you want to add?
Yeah, I was just going to elaborate on that exact thing there a second ago, Steve, on Bartley's question. But Dr. Roussin mentioned to me this morning, I believe it's 2 weeks is the turnaround time when we send for testing, that we get the testing back. But that also the isolation period is prolonged for household members to ensure that there's additional protection there in the event of a household transmission.
Correct, yes. So this individual was tested on the 21st, and we have received a sample on the 22nd of January, and had been self-isolating with 5 household contacts for the entire time. And none of those contacts have turned case. And then, so as the Premier mentioned, for the variants of concern, we won't be accepting isolation within the home. So somebody who chooses to self-isolate at home, all of their contacts will have to self-isolate 14 days after the last potential exposure, which in most cases would be 10 days after symptom onset. So household contacts could have to self-isolate for up to 24 days.
Thank you. And on the restaurant reopening issue, I realize it's impossible to make specific orders for every minute possibility, but who is in charge of ensuring that people sitting at a restaurant table are members of a household only, and who gets fined? Is it the customer or is it the business owner?
We've wrote these orders to have that burden on both the people who should be a household and the operator. So we want all Manitobans to share in the importance of this. And so if there was some reason that it was non-household members sitting at that table, the enforcement could be enacted on both the people at the table and the operator of the business.
From CTV Winnipeg, Jeff.
Oh, hi, Dr. Roussin. To follow up on that, so our restaurant, our servers and then owners of these restaurants and lounges, is the expectation that they will ID people, or do you just ask them if they're from the same household? Like how do they prove it? I guess that's one of the questions I know that people in the industry are asking.
Since the beginning of our orders, they've always been based on reasonableness. And so if we're required right now to take down information on people for contact tracing at these areas. That could involve just simply looking at that address. For the contact collection, people have to write down their address to be able to contact them should a case arise. So there's a lot of reasonable areas here that that can be done. We're not going to be at some unreasonable level where a family with younger children come out and you have to produce a birth certificate or something like that. That's not what we're talking about here. We're talking about a reasonable way to ensure that people at a table are from the same household.
The biggest consequence that a restaurant would face wouldn't be the fine. It would be the reality of increased case numbers as a result of not enforcing these rules at the restaurant level. Because if in 3 weeks we see case numbers spiking, the price of that may well be we have to reverse these orders, and that would be a very, very negative consequence for restaurants. So the industry understands that, and most industry members have been wonderful and supportive of the safety measures, of adopting protection measures, and in fact of keeping a record of who comes into their facilities. So we expect that to continue, because it's in the best interest not only of all of us who might like to share a night out with our spouse or whatever, but also in the best interest of the restaurant industry and other industries as well in our province.
Dr. Russo, my second question is about gyms and some of these, I guess, other physical activities. For some gym and fitness centers, they're saying, like, we can do the group settings physically distanced, and we can do it safely. It doesn't just have to be one-on-one. I'd like you to respond to that, because some of these places say that's basically our model, and some of them, I think are unsure whether they'll be able to open or not, even with these rules, because it doesn't fit their business model.
Yeah, and this is a challenge of this pandemic, right? This is the nature of the virus, not somebody's lack of desire or hard work. So we're at a spot right now where we feel we can loosen some restrictions. We look at areas where we can do it. We look at areas where there's significant benefit. So right now, at this stage, we're comfortable with opening up for one-on-one or individual training, not group classes. I know that there's a lot of places that think and probably have great protocols in place, but we get that message from every single sector right now, sectors that are open and sectors that are not open. Everyone feels what they do is safe and doesn't promote the transmission of the virus, yet we still had October and November and December. So we just know the nature of this virus spreads when we have a bunch of people indoors at the same time. So we're going to do this cautiously. I hear what they say. They probably have done a tremendous amount of work, but for right now, we have to do this cautiously because we've been here before. We hear about how safe everything was, but we weren't safe in November. So we have to do this very cautiously.
From City News, our final reporter this morning, Mike.
Hey, good morning. My question is the test that came back positive for the UK variant. Why was this test initially sent away? Is it because there was international travel linked to it, or was it because of different symptoms? I don't know if you'll be able to answer this, but I appreciate it again.
Yeah, no, thanks. So it's related to travel. So we send off all travel-related cases for the sequencing, and any cases that are linked to a traveler. And then we also send a proportion of cases from, say, an outbreak. So when we have outbreaks in, say, communities or in institutions, we'll search for the variant there. And then we do a random sample of other cases. So we do quite a good sample of all of our active cases to be looking for these variants.
I'll add, Mike, if I could, 2 points. One, that this is why we've enacted stronger travel self-isolation requirements in Manitoba. And I would also mention that, of course, we're not an island, and that cases of variants of concern have been identified in 7 other provinces. Manitoba is the 8th, and so this should be a reason for additional caution and discipline on the part of all of us, not just the public health officials that administer tests, but all of us.
And then my follow-up question, thank you for that, is a question that both of you might be able to answer. Mr. Premier, in your opening remarks, you said we can't let fear be prevalent, but then you also mentioned a lot of good points about the vaccines may still be far away for a large portion of us, especially those under 30. The new variant announced today, obviously. Should Manitobans be somewhat fearful of the virus just to kind of keep cognizant of it, or is it more of respecting the risk?
It's following the fundamentals and playing defense. We have to stay cautious and aware that the fundamentals do work, that the distancing and the other approaches that we have used effectively have to continue, that we're in a marathon. And we have to understand the reality. It's not just under 30s waiting a long time, it's all of us. These are the numbers. Manitoba, good news, Manitoba is second in Canada for percentage of people fully vaccinated. That's great news. Bad news, we're lagging behind 20 countries in terms of total vaccinations delivered, according to the University of Oxford data. And the worst news is that we're 37th overall now and sliding for the percentage of the population that has received a vaccine dose. 37th. So we have to be cautious. The cavalry's not here yet. We are the cavalry. We are the people who can protect one another, and we've been doing it well, so stay at it. That's my closing message, I guess, for today. Caution, a good day, but a day to remind one another that we need to be cautious and careful as we start to give people the opportunity to get some freedoms back. A good day for Manitobans.